Hi, Dr. Paul. I want to talk about a subject that's very near and dear to a lot of people, which is sleep. Um, we all need it, and we all need enough of it, and not too much, but enough. And a lot of people suffer with insomnia, and insomnia is really not that good for you. I mean, you really should be getting ideally about a good 8 hours of sleep, more or less. Some people 6 or 7 is okay, but basically, why do people have problems with sleep? Well, there's different reasons. Mood disorders are a very common reason. When someone has an anxiety disorder, the more typical is that they can't get to sleep easily because they're worrying about things. Their mind doesn't shut off at night, and then they just can't shut down. And then they're tossing and turning. They're looking at the clock. So when people with anxiety very commonly suffer with insomnia. People with depression also do too. But people with depression more often they get to sleep okay, but then they wake up in the middle of the night, and then they can't go back to sleep as easily. We call it early morning awakening. So that's because, and then they think about the sadness and why they're sad and why they're depressed. Bipolar disorder is pretty much almost everyone with bipolar disorder has insomnia problems. With that, it's the mind is racing, it just doesn't shut down, and these people with bipolar just can't stop their brain from thinking about stuff, and so that's really it's something that really is important to treat. So there's various reasons, and so how to treat it? Well, we start with the basics. We call sleep hygiene. So sleep hygiene means, maybe don't do anything really stimulating. Okay, so your bedroom should be for two things, sex and sleep. So watching a lot of TV late at night, it may be a little bit too stimulating. So watching a lot of TV, then turning off the TV and trying to shut down. Sometimes you're still thinking about the show. Being on devices, and too much exposure to light. So being on devices which a lot of people are on, social media. That should shut down. Being on the computer should shut down. So basically, sleep hygiene meaning have a routine for bedtime. Try to do things that are relaxing. Listen to some music. Read a book. Reading is a really good way to. And again, it depends on what you're reading. If you're reading like a mystery novel or a suspense novel, and then you're closing in a chapter like what's going to happen next. That may not be the best thing to read then at bedtime. You might want to read something that's a little bit more boring in a sense, but that you still want to read it. But it's because a lot of people will read a little bit until they start to feel tired and then put the book away and then go to bed. So that's a way of doing it. So yeah, so keeping like a schedule, like learning how to like tune down in the evening. And now, if you still suffer with insomnia, well, see your doctor about it, because if there's a mood disorder, whether it's the three I just said, well, treating it can help with sleep. There's also medications we use for sleep. I try to not start with things like Ambien or Lunesta or benzodiazepine like tranquilizers. That's not my favorite thing to start with. That's really kind of if nothing else works and then we're left with no other choices. But there's other really good medications like trazodone, doxepin that I use for sleep that are very effective and non-addictive. But again, sometimes if you treat the underlying mood disorder, that can help quite a bit. With bipolar disorder, being aggressive with treatment, I think there's the number one thing I probably use for sleep is Seroquel. Seroquel is amazing for sleep quality. It's sometimes too strong for certain people, but for some people, it just takes a low dose of it. For people who with anxiety or depression, a higher dose would be for bipolar disorder typically. But Seroquel is only one of many. I like Seroquel because I've had a lot of experience prescribing it. It's a great medication for sleep quality. It really gets you into a deep sleep. But with anything we give for sleep, we got to watch for we don't want to go too high so the person sleeps too much and is too tired the next day. That means we've either gone too high in the dose, or or if we're seeing that even in the low dose, it means it's the wrong medication. So, but again, exercise. Another thing that's really helpful for sleep is maintain a regular exercise program. Exercise in general, regular exercise is very good for reducing stress. Also, learning how to meditate. So sometimes people, they practice, they do yoga, they do meditation. So if you learn those kind of skills, you can meditate yourself into sleep, and so we can learn, which is teaching yourself how to relax your brain and how to stop thinking. So when you get in a meditative state, the goal is to not think. And so if you're meditating and you're thinking about all the stuff that stresses your day, well, you're not there yet. You need to get there. So, but yeah, those kind of things can help. So there's a host of things that can help. But it is a very important subject, because if you don't get a good sleep schedule going, it definitely can negatively affect your day, your productivity, your mood. Being tired in the daytime is not fun when you're trying to work and you're so tired because you didn't sleep well the night before. Some people try to catch up on the weekends, but sometimes that's okay, but it doesn't solve the problem during the week. So some people try to nap in the daytime, and the problem with napping is then sometimes when you nap in the afternoon, then you don't sleep well at night. So that can help with some people, but not everyone. And not everyone can afford to take a nap. Some people are working; they don't have the time to take a nap. So anyways, I wanted to really focus on the importance of this subject of sleep and why, and it's important for your mood, it's important for your mental health, your physical health. It's important all the way around. Thanks for listening.